Good morning, beautiful. So today this is Dr. B, a Dr. Beautiful Aesthetic. I'm talking about the most talked about and most misunderstood skincare component is retinol. What do we know about retinol? So all we know, retinol helps your skin peel, get red, and doctors will tell you need retinol for acne, but nobody likes putting on retinol because it makes their skin feel even more drier. So what do we know retinol does? So retinol increases the skin regeneration. So when our skin is young, it's regenerating quite a bit. As we get older, our skin is actually regenerating a lot less. And if you do end up having any wrinkles, texture concerns, any acne, any pores, it just takes a lot longer to heal. And sometimes it almost seems like it is not healing at all. So retinol, what do we do? What do we know to pick the right kind of retinol, and how often do we put on, and all those things. So rule number one is pick a medium strength retinol. There is no point in picking anything less than 0.5, I would say, because it's not worth it. It's not worth the hassle, I would say. If you're gonna put it on, just do 0.5 or go at 0.1. Now prescription grade retinols are definitely better. It's just like getting an antibiotic or a medication. You don't want to get a medication off of Amazon and apply it on your skin because you just don't know what that has. Simply, your retinol can be prescribed by your family doctor or physicians, and you can actually get a reliable concentration of retinol with a pharmaceutical grade skincare. So our very own Canadian brand Vivier Skin and our US based Zeo Skincare, they both specialize in retinols, both for two different reasons, and they have very variable and different types of texture of retinols, but either way they're reliable concentration wise. So if you say a 0.5, it's going to be a 0.5. If it's a 0.1, then it's a 0.1, and you can count on that. So rule number one, you don't want to apply it every day. You don't want to apply it every single day, because simply your skin will go from whatever your age is, like 10 years younger skin in like 10 days. I mean, that's amazing if you can put through that. That's actually Dr. Zainobaji's caption for skincare. He just wants everything done within a week, and which is amazing, as I said, but you have to be prepared to see the changes, and it's going to be drastic. But if you're not wanting a drastic change, and if you're like, well, I can't quite hide from everybody for a week, I need a more gradual change in my skin, then you want to start with once a week application, and then you want to start increasing that application maybe once every 2-3 months, depending on how your skin is reacting. Right off the bat, when you start using retinol, the ideal situation is you want to put it as a sandwich layer. So you put on moisturizer, then goes your retinol, and then goes your moisturizer on top. Why? Because then there is less chances of skin irritation. Initial stages when your skin is regenerating or healing, there's going to be a lot of cracks and divots and skin break. So oftentimes that's the most common thing. Patients will come and say, well, you wanted me to apply this, but actually my skin burns. I feel like it's almost on fire, and I can't tolerate, and so they just stop using it altogether. So it's kind of not helpful. So if we want to use it, and you want to be able to use it, I think the sandwich technique is really good. If you're brave enough, you can go directly on your clean skin as well. Now when you apply, again, first few times or a month or two, I would say go with a pea-sized amount for your entire face and neck. So I would say take a pea-sized amount on your tip of your finger, mix it within your two fingers, go like dab, 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 and your neck, and then you just use these two fingers to kind of mix it around, move it around. You don't really need to rub or anything like that. It will get absorbed in your skin. Just keeping in mind, these two fingers will also be peeling because they have retinol. So if you don't want that, wash it off. Now, pea-sized amount is usually good to get started. Down the road, instead of going higher amount, I would say go more frequent. So still using pea-sized amount, like maybe 2 non-consecutive days or maybe 3 non-consecutive days, and kind of so on. What are the most common side effects of using retinol? So we kind of talked about that in the beginning of this video. So most common side effect is skin regeneration. So what does it look like? It looks like your skin is peeling like a snake skin. For some people, it's a lot. For some people, it'll be kind of a little bit more on the corners of your nose or corners of your eyes or corners of your mouth, and then sometimes in the nasolabial fold, and then kind of where the line joins and goes to the corner of your chin. I have also seen some people by mistake put it too close to their lips, and you can then see some dry skin peeling from that area as well. Redness is another common side effect, and again, usually if you're seeing a red, cracked, dry skin, likely you need a lot less than what you're applying. So usually I would say whatever amount you're applying, just cut it into half and apply that, or just do it like even less often, maybe once every 2 weeks, something like that. The other side effect of retinol is also some drying and cracking of the skin. That is an extreme situation. So if that starts happening, and if you are really applying it very less often, we also have to consider that you may be hypersensitive to the product or some ingredient to that. So ideally you can switch it out with a different product brand or a prescription grade, another product altogether. But retinols, typically if you're allergic to it, you probably will be seeing that within the first couple of uses already, and that typically feels a lot different than the dryness from retinol. It'll be more like a blotchy redness and more irritation, more quicker reaction, and typically you might have to just take a reactant, and if that goes down, you just know it's a more allergic reaction, which is possible but quite rare, I would say. Now, what can we expect in terms of retinol and changes? So retinol, as we discussed, it is increasing the skin regeneration. So when we get older, our skin is not regenerating as fast. So whatever that skin is collecting on the top layer of our skin, whatever pores, everything is just there. So when we use retinol, after a while you should start noticing smoothing out your skin, kind of less amount of pores, less amount of fine lines and fine wrinkles, and if you would have a lot of acne, then we would definitely see reduction in acne as well. So acne has been discussed in detail in another video, so stay tuned for that one. But generally, just a quick thing about acne and retinol is common misconception is if you apply retinol, acne goes away. But the reality is acne actually worsens before it goes away because your skin is regenerating. So your acne is going to show up quicker while you're on retinol, and then it's going to have your clean skin rather than going off just by itself. So especially now around that perimenopausal age, women will oftentimes come in with complaints of those rare, weird, like jawline or chin acne. Same concept for them as well as a teenage acne. It will actually get worse before it will get better. So you just have to hang tight for that 6 to 8 weeks. And energy devices will also help in reduction of the acne, but retinol alone can handle it. It might take a little longer, but it definitely will help it. So bottom line, pick a retinol, use a retinol, try to go for a pharmaceutical grade so you know what to expect. And if you have any questions, concerns, or anything you feel like I should have discussed, feel free to direct message me, and I'll be happy to discuss that on our future episodes. Until then.